Now, May is Women's Health Month and the perfect time to talk about what new and expectant moms should know before, during, and after pregnancy. OBGYN and UnitedHealthcare Medical Director Dr. Jaime Testa joins us with important insight.
Dr. Jaime, many women in the United States face preventable risks during pregnancy and postpartum recovery, often because getting care can feel complicated and overwhelming. So we're so excited to have you joining us here. I first want to start out with, what is the first thing someone should do if they think that they might be pregnant?
The most important first step if someone thinks they're pregnant is to contact their doctor or care provider right away. Your doctor can confirm your pregnancy, but also together you can create a personalized care plan to support your specific needs, including your physical and mental health needs.
Wonderful. And going off of that, why is it so important then to begin that prenatal care during the first trimester?
Starting prenatal care early, ideally in that first trimester, is critical to help improve health outcomes for both mom and baby. These early visits help to identify potential risks as soon as possible so that moms have the information and resources that they need right from the start. But additionally, these visits help to create this reliable support system so that you can tailor a plan specific to your needs, including physical and emotional support. And very important to hear this, for those individuals experiencing substance use disorder or opioid use disorder, keep in mind, your care team is there to support you, not judge, and to help ensure the best outcomes for both you and your baby.
And so what do you then, advice do you have for those expectant mothers during that first trimester and when they're navigating all those doctor's appointments? Because there certainly are quite a bit.
Yeah, and there's a lot going on both in your appointments and in life. So I would offer a few simple tips. First, write down your questions, no matter how big or small, and make sure you bring them with you to every appointment. Second, don't hesitate to ask about things like nutrition, exercise, breastfeeding, and what to expect during each stage of your pregnancy. And third, keep track of your health information and bring it with you to every appointment.
Amazing. So now we're gonna fast forward here a little bit. When should women then schedule that follow-up care after giving birth? And what does the postpartum care address then?
Well, postpartum care is just as important as prenatal care. And we recommend women see their provider within about 3 weeks after delivery, and then ongoing care is needed. But to then really have that full comprehensive visit, ideally no later than 12 weeks after delivery. And during these visits, a whole host of topics are covered, like healing and recovery from delivery, breastfeeding support, and adjusting to life with a newborn. But it's also a great opportunity to talk about mental health. So moms, if you are feeling unusually overwhelmed, anxious, unusually low, please speak up about this. These could be symptoms of postpartum depression or anxiety. And these are common and they are treatable, and there is help available. You do not have to go through it alone.
Well, Dr. Testa, you have just been a wealth of information. Thank you so much. Now, where can people go then if they'd like to learn further information?
I would encourage everybody to check out everypregnancy.com for reliable information and resources.
All right, again, you could visit everypregnancy.com.